Today's date is October 13th. We're here with Jean, who came to us from Northern California. I have your permission to video you, and my purpose is I want you to get better so I can post it on YouTube. Is that okay?
Yes.
Thank you. Jean has a long history of problems. She's got problems in her neck, and she's got problems in her back. And she's got other problems, but they're personal. This one, what we're going to do now is just see what she can do. I'd like you to turn your head to the right, please. Turn it to the left. Good. And now I'm going to ask you to bend your head down and touch your chin to your chest. Very hard to do. And bend it back. Okay. And that hurt you to do that, didn't it? And I think anybody can look at you and see that you're in pain. And also, the way you're sitting in that chair, you're leaning forward. Can I see you get out of that chair, please, and walk to the door? All right, come on back to the chair and sit down, please. And you needed to use both hands to sit down, right?
Yeah.
All right. The viewer needs to know you'd had several back surgeries. 5.
Yes.
You had 4 corrective surgeries and 1 to take the hardware out. Is that correct?
Yes.
But you had no surgeries on your neck.
No.
And this started many, many years ago when you were lugging around a 100-pound sack of potatoes, right?
Yes, except for my neck.
What happened to your neck? How did that start?
It was a car accident. The guy was passing us up when he hit us
How old were
on a
you?
left turn. It was 2013.
So that's just a couple years ago.
Yeah.
Okay. Thank you. All right, Jean, we just did your pelvis. We did a suprapubic injection to your pelvis for reasons. You have a bladder issue, and it'll take time for us to find out what happened there. But I asked you to get off the table before we did any back or neck treatments, and to see if you notice any difference in walking or how you feel anywhere in your body, including your pelvis right now. Do you notice any difference?
Yes.
What do you notice?
Strange feeling when I'm walking.
Is it unpleasant?
No.
Is it better? Can you, or
It's a
just
little bit better. Yeah.
what is better in your walk? Walk to the door. All right, and come back.
Definitely not as painful.
What'd you say?
Definitely not as painful.
What is not as painful?
Walking.
Walking.
Yeah.
All right. And in your back, you were having pain in your back,
Yeah.
correct?
Right.
So that's better at this
That's
point.
better. Yeah.
And that's from an injection right here,
Yeah.
correct?
Yeah.
Okay. Thank you. Just did your neck about 20 seconds ago. Can you turn your head to the right, please? As far as you can. Turn it to the left as far as you can. Okay. Now what I'd like you to do is bend your head to the back as far as you can. And now bend it down as far as you can. And you can just about make your chin to your chest now. What do you notice? It's only been less than a minute. Do you notice anything?
Well, it's definitely less pain.
Definitely less pain?
Yeah.
All right, well, we'll check it again before we're done.
Okay.
Now Dr. Shear just did your treatment on your back. Walk to the door and back. And sit down on the chair. And please stand up. Now sit down without using your hands. And stand up without holding your hands. What?
What do you think?
Wow.
You did it.
That's pretty good.
You did it. You're on YouTube too, right?
That's pretty good.
Okay.
All right.
All right. Now, let me see what you can do with your back. You bent forward pretty good before, right? Go to the side as far as you can. Go to the other side as far as you can. I think that's better.
I think so.
Wouldn't
Yeah.
you say that's better?
Yeah.
Okay. Now, you were not able to extend your back. bend back as far as you can. That's good. Okay, and if I was holding you, it would even be better. Video me. Turn this way. You were not able to extend your back anything before, right? Let's see you do it now. Arch, 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 arch. Okay. She couldn't do any of that before. All right? Now, sit down here, if you would. Now let's see you turn your head to the right, please. No, turn it.
Turn it.
Oh my God. Oh my. What do you?
I saw her move.
That's pretty good.
Turn it the other way. Oh my God.
What do you think?
Oh my God.
What
Bend
do you
your
think, Gene?
Yeah.
Huh?
bend your head down. Look how fast she's going. Bend it back. Oh my God.
That's great.
This is Dr.
That's
Shearer. We're going to get him in a moment. What do you think of that?
That's great. I love that.
So do I. So
Wait,
do
do you
I.
notice you notice a difference?
Oh yeah, yeah.
Oh yeah? All right, we're going to measure it now, okay?
Okay.
Now, for the viewer, we have Dr. Richard Shearer here and his lovely wife for training and verification. And you saw this before, and she's your patient,
She's my
right? She's your patient. Come on over here.
Yeah.
I want you to see this. Now, you got a smile on your face. You did not have a smile on your face when you walked in the door.
No.
I want you to look at this, dear. Hold it. Look at the numbers. Your flexion extension when you walked in the door was 96 degrees total. Your flexion extension now is 72 is 114 degrees total. Your rotation was 36 and 24 before, that's 60. You now have 152 degrees of rotation. Your side flexion was 22 and 22, and your side flexion now is 32 and 28. What are your thoughts?
I love it.
Dick, would you have believed this?
Yeah, how does it work?
We'll talk. All right.
I mean, it's amazing.
It is.
Okay.
Don't be so verbal, Gene. Don't be so verbal.
I'm pleased. I'm really pleased. Now, I can't tell you what's going to happen over the next several days, but this is fairly typical. And Dr. Shearer may have to do more on you. All right. There's a double effect. One could be the local anesthetic, but the other is ozone, and ozone can work instantly. It's amazing to me how much it can attenuate inflammation, like right on the spot. So I hope it was worth it to come down here from
Oh, big
Shasta.
time, big time.
Okay. Thank you very much.
Oh, thank you.